This reminds me of San Francisco in the early 70s. It's kind of exciting. You never know what's going to happen at the ashram. That's one of the nice things about it. Anyway, the idea is that if you don't deal with the underlying cause of a problem, this is something that Swamiji used to say to me over and over again. I wasn't really a very good student, and he'd, kind of have to hammer it in sometimes. He'd say, well, what is the cause? And what is the cause of that? And what is the cause of that? And, keep going farther back. And the idea is that the farther back in the chain of events you go, the more powerful the healing can be. But if you don't go very far back, if you just literally or figuratively bypass it, literally with bypass surgery, even the name itself tells you the problem. It's just bypassing the problem. You're not addressing the underlying cause. If you just bypass a problem and you don't also deal with the cause, then more often than not, the same problem comes back again. Or you get a whole new set of problems or side effects that you hadn't counted on. Or you're faced with painful choices. And that's as true on a health policy or a social level as it is on an individual level. It's as true for just about anything as it is for heart disease. We know now, for example, that within 5 years, half of the bypasses have clogged up. And within 7 to 10 years, 80% have clogged up. Last year, more money was spent on bypass surgery than for any other operation in this country. Over $18 billion. Angioplasty is the same problem. If you blow up a balloon inside an artery that's blocked, within 4 to 6 months, somewhere between a third and half of them have clogged up again. And we spent about $6 billion last year in this country on that one procedure. It doesn't matter what you do, if you do it with a balloon, or you do it with a laser, or you do it with an atherectomy, or you do it with a rotablator, or you do it with a roto-rooter. It's still the same problem. But if we can deal with the underlying causes, in this case of heart disease, what we eat, how we respond to stress, how much exercise we get, whether or not we smoke, the quality of our relationships with other people, then we find that your body has a much greater capacity to begin healing itself than we had once thought, and much more quickly than we had once thought. Within a few days, if people make these changes, their chest pain tends to go away very quickly. Within a month, we've measured the blood flow to the heart can improve. And the heart begins to pump blood more normally. Within a year, we find that even severely blocked arteries can become measurably less blocked. And the most recent findings, which we presented last November at the American Heart Association's national meeting in Atlanta, is that after 4 years, there was even more reversal than after 1 year. And a few of our patients have gone on to have tests at 6 years and even 8 years, and we're finding there's even more reversal after 6 years or 8 years than after 4 years. And I'll show you some pictures of that in a few minutes. So instead of getting worse and worse over time, which is what usually happens when someone is told they have heart disease, they're told you're going to just get worse. It's just a question of how quickly you're going to get worse. But instead of getting worse and worse, we're finding that many people can get better and better. And these findings are giving many people new hope and new choices that they didn't have before. And for me, there's nothing more rewarding than to work with people who've, basically been told they're going to get their affairs in order, they're going to die, and they're just going to have to live with this pain for the rest of their life. And to say, no, that's really not the case. You have other choices. And then through their example, and that's part of the value of doing research, is that to demonstrate to other people that they also have that choice and that they too can get better. It's like until Roger Bannister broke the 4-minute mile, everybody thought it was impossible. Once one person did it, then suddenly it became fairly routine. And it's the same here. Before, people thought once you had heart disease, it was impossible to reverse it. But now that we know that it can be done through the examples of people like Rudra and others, then we know that other people can do that too. That gives people that sense of what's possible. For me, I had the fortune of having someone like Swami Satchidananda in my life to be a teacher. And so I'd go to him, I'd say, well, what do you think? I'd like to do this study. You think it'll work? He said, I know it'll work. So to me, it's like, well,